Thank you for the opportunity to join the SPARKS Virtual Conference 2020. It's a real honor and pleasure to be able to present this poster on alcohol policy as catalyst for optimizing health-related social protection. My name is Maik Dünnbier. I am the Director of Strategy and Advocacy at Movendi International. And the details of this poster you can also find on our website, movendi.ngo, where we provide comprehensive and compelling analysis of alcohol's adverse effects on social protection, how alcohol fuels social inclusion, undermines human capital, but also how alcohol policy solutions can be used to catalyze the strengthening of social and healthcare systems. So what we want to show you here is a conversation that we are also taking to the United Nations, for example, to the UN Commission for Social Development, where we talk about the different aspects of alcohol as an obstacle to sustainable development in general. We can show that based on our analysis, alcohol adversely affects 14 out of 17 SDGs and cuts across as a hinder all three dimensions of sustainable development, the economic, the environmental, and of course, the social one. And to exemplify this, we have just shared a few key facts about alcohol on the left side of the poster. So you can see here that especially in poorer communities and families affected by alcohol use disorder and other kinds of alcohol harms, such as gender-based and domestic violence, and especially in low and middle income countries, alcohol tends to crowd out other more productive household spending, for example, on education, healthcare, and healthy food. That means that already marginalized and vulnerable people, due to alcohol harm, become even more vulnerable and cannot benefit from the overall provision of social and healthcare protection, should those services exist in countries. Desperately needed resources are taken away from the little available for food and for other basics, for example, and socioeconomically exposed people are much less able to avoid adverse consequences of their behavior due to lack of resources. People in poor and vulnerable communities have less extensive support networks. So even if the formal social protection networks don't work, even informally, there is much less of a support system for people in marginalized communities affected by alcohol harm. And for example, that is because they have fewer resources, fewer persons to motivate them to address alcohol problems, fewer resources to put them back into the system where they can get help. So this is part of the story, but the other side of the story is that since alcohol has these adverse effects across the SDGs and especially also in this social dimension and socio-economic dimension, there are evidence-based alcohol policy solutions, and they work as a catalyst for social protection, especially in achieving universal health coverage and reaching health for all. And this is actually best exemplified by an analysis in 2010 done by the World Health Organization and reported on in the World Health Report in 2010, where they found that just one alcohol policy solution, alcohol taxation, can have significant benefits for providing and strengthening the health system. They found that raising taxes on alcohol to 40% of the retail price could have a big impact. Estimates for 12 low-income countries show that alcohol consumption levels would fall by more than 10%, while tax revenues would more than triple to a level amounting to 38% of total health spending in those countries. Even if only a portion of the proceeds were allocated to health, access to services would be greatly enhanced, according to the WHO. So this clearly shows the potential of alcohol policy solutions for catalyzing social protections, especially within healthcare services, but also in wider social services and social protection services. As I said, you can find more information at movendi.ngo, and you can also get in touch with me. Please do so. I'm happy to explain more, discuss more, and also find ways to address these issues in countries and communities around the world. Thank you very much for the opportunity. Thank you very much for the attention.